In this presentation, we'll be taking the time to tell you a little more about digoxin. This drug is most commonly used to treat mild to moderate heart failure in adults, as well as chronic atrial fibrillation. It is also used as a treatment in the control of supraventricular tachyarrhythmias.
Digoxin is officially classified as a cardiac glycoside, also commonly referred to as digitalis glycosides. They come from the digitalis foxglove plant, which is where they get their names. Interestingly, cardiac glycosides aren't first-line medications anymore due to their risk of overdose, but they are still used if first-line medications proved unsuccessful. Digoxin is the most commonly used cardiac glycoside.
Cardiac glycosides work upon cell membranes, inhibiting them from pumping sodium out. The increased amount of sodium retained in the cell causes more calcium to build up in the cells as well. When all that excess calcium is finally released, it creates stronger heart muscle contractions, allowing each heartbeat to be stronger and more efficient at pumping an adequate amount of blood out of the heart. This increases cardiac output and is the main therapeutic outcome in heart failure patients. These medications also slow down ventricular response by slowing the electrical signals from the AV node of the heart. Slow electrical signals mean a slower heartbeat and is the main therapeutic outcome for those with supraventricular arrhythmias, such as atrial fibrillation.
Common side effects of digoxin include dizziness, headache, diarrhea, rash, and visual disturbances. Less likely, yet more serious adverse effects are those associated with digoxin toxicity and include severe GI upset, neurologic abnormalities beyond a headache, facial pain, personality changes and confusion, bradycardia, and new onset ventricular arrhythmias. If these occur, the provider must be notified immediately.
When educating patients and their families about digoxin, it is essential to start with a clear understanding of the medication's purpose and how it works. Digoxin is primarily used to treat heart failure and certain types of arrhythmias, as it strengthens heart contractions and helps regulate heart rate. Patients should be informed about the importance of adhering to the prescribed dosage and schedule, as consistent medication levels are crucial for effective treatment. Emphasizing the need for regular follow-up appointments for monitoring heart function and digoxin levels will help ensure safe use of medication. Recognizing the signs of digoxin toxicity is a critical aspect of patient and family education. Patients should be instructed to be vigilant for symptoms of nausea, vomiting, confusion, and visual disturbances, because these all may indicate elevated digoxin levels. It is vital for patients and their families to understand that if they experience any of these symptoms, they should seek medical attention immediately. Additionally, education about maintaining adequate potassium levels through a balanced diet is important. Nursing interventions for patients on digoxin focus on monitoring and promoting safe medication administration. One of the primary interventions is to assess the patient's heart rate and rhythm before administering the medication. Digoxin can cause bradycardia, so it is crucial to check the pulse for at least 1 full minute and hold the medication if the heart rate is below the prescribed threshold, which is typically 60 beats per minute. Additionally, nurses should educate patients about the signs and symptoms of digoxin toxicity, which was talked about above. Another vital intervention is to monitor electrolyte levels, particularly potassium, magnesium, and calcium, as imbalances can increase the risk of digoxin toxicity. Nurses should regularly review laboratory results and collaborate with the healthcare team to adjust the patient's diet or medications as necessary. It's also important to provide education of the importance of adherence to the prescribed regimen, including taking the medication at the same time daily and not skipping doses.
Created using Powtoon.